Hi, I am going to be discussing Virtual Care Now. It is a chronic care management telemedicine program that I'm proposing. My name is Holly Meyer. I'm a clinical application specialist in the clinical application ambulatory department of Trinity Health. So Virtual Care Now, what is it? It's a telemedicine program pilot that I'm proposing for chronic care management of diabetes, hypertension, depression, anxiety, chronic pain, and others that are deemed necessary by the provider. So how does it work? So there's visit types. So currently chronic care visits are scheduled every 3 months in the clinic, but with the proposed pilot program, the patients would be able to see providers virtually at 3 months and then in the office at 6 months. They would be a doctor or mid-level to patient telemedicine visit type. Patient types, so they must have chronic conditions such as diabetes, hypertension, hyperlipidemia, infectious diseases, chronic pain, depression, anxiety, or any other chronic conditions as deemed appropriate by the provider. So consent. Patients must sign a consent to participate in the pilot program in addition to when the program is available for all clinics. Billing, Mercy Medical Center, North Iowa Centralized Billing Department will bill the telemedicine visits through the same current process via self-pay, sliding fee scale, or other insurance companies. So what's the technology? So the technology involved for providers would be that they would use their laptops, which they currently have. They would need to download the Zoom app, and they would also utilize the current EHR of AthenaNet. And then patients, they would need to have access to a laptop, tablet, or smartphone to participate. They need to be able to download Zoom and My Vitals app and then utilize their current home blood pressure monitor and or glucose meter. So technology. So the My Vitals app is an easy to use and free app. It is an app where the patient would download and then they can record data. So blood pressure, pulse, glucose, weight, things like that. They would enter it onto this page and then they could actually send it to the provider is what they'll do in order to share that information, or they could just tell the provider over the phone. It just really is going to be up to each provider. The next app is the Zoom app. This is, again, a free app, and the providers would schedule or host a meeting with that patient for the telemedicine visit, and then they would give the patient a meeting ID. So the patient would then join a meeting and then enter their ID. So then they would see their name, and then the provider would know that, yep, this is Holly Meyer. So what are the benefits? So providers, they have increased satisfaction. Providers will be able to follow patients with chronic conditions, whereas they may not have seen them in the office as frequently. And then they'll have increased care and continuous monitoring. Also have a significant benefit on patient outcomes due to increased patient adherence and engagement. Patients are more likely to participate in their own care when they have a better understanding of their care, which in turn benefits the provider. Patients, they have increased satisfaction as well due to not having to travel many miles to see their provider or even leave their house. Sometimes patients have transportation difficulties, so that obviously can make it a lot more difficult for them to go to the doctor. Then an increased level of care and monitoring helps ensure the patient is taking care of themselves. And then also the less visits to the doctor have also a significant benefit, not only financially, but time-wise. They will have less ER visits, urgent care visits, or even inpatient admissions, which also helps financially for patients, health systems, and insurance companies. So this is a large financial impact. So metrics. How do we measure success of this program? Obviously, we need to understand if it's working. How is it working? What's the outcome of this program? We want to ensure it's functioning as intended and not just That's functioning okay. So first of all, we want to ask the patients what they think by utilizing Press Ganey or SurveyMonkey, and then determine or understand it and evaluate those results. This is an easy, free, and anonymous way to get feedback from patients. And we can ask them point blank, what do you think? Be straight with us. If patients would rather do it on paper, then maybe we have to look at that. But most of the patients that are utilizing their smartphones and apps are more likely to want to fill out a survey electronically than on a paper. But it's something that we can look into. Reporting is another way to measure success. So we can report out of AthenaNet. We can report all of these things, such as lab values. Lab values as in A1C, glucose, blood pressure readings, things like that. And then medication adherence is helpful in understanding if a patient is taking their medications as they're instructed. The PHQ-2 and PHQ-9 is also the screening results that we could look at to determine if patients with depression and anxiety are actually controlling their condition. So how are we going to do this? I'm proposing a pilot to start at Mercy Family Clinic Forest Park with 2 providers. We want to ensure we have patient consent. We want to provide education on the Zoom app for patients, providers, and staff and then My Vitals app for patients and staff to understand how the patients use the app. We also want to evaluate our metrics and see if the program is working. If it isn't, then we need to determine what changes we need to make. And then if it is working, let's determine the next steps for the next clinic or clinics to implement. We do need to have a policy in place, and so Mercy Medical Center North Iowa will need to ensure we do have this policy in place regarding the Virtual Care Now telemedicine program to also make sure that patients and staff are all covered in our licensure, and provider licensure process would remain the same as it does for in-office visits. Patients must be willing to sign a consent form to participate in the program. There will also be visit requirements such as using Zoom and My Vitals app to ensure we are providing the best care to our patients. They have to be seen in order to be reimbursed from insurance companies by way of audio and visual encounters. So that's something that's required. And then payment. We need to make sure we will follow the same process as in-office visits where we can utilize self-pay, sliding scale fee payments, Medicare, Medicaid, and private insurances. So are you ready to get started? We want you to help make a bigger difference in patient healthcare outcomes. The time is now, so let's work together to make a difference by using Virtual Care Now.